Autism, also known as autism spectrum disorder, ASD, is a developmental condition that affects the way a person perceives the world and interacts with others. While autism can manifest in different ways in each individual, there are early signs that, when identified, can help parents and professionals seek an appropriate diagnosis as early as possible. The earlier the diagnosis is made, the more effective the interventions will be, giving the child a better chance to develop social, emotional, and cognitive skills. These early signs are often subtle and easy to overlook, especially when compared to the typical development of a child. However, being aware of these differences can make all the difference in the journey of a child with autism. In this video, we'll explore 10 early signs of autism that you shouldn't ignore. If you notice any of these signs in a child, it's important to seek professional guidance to ensure they receive the necessary support. One of the first signs that may indicate autism in a child is a lack of eye contact. While eye contact is a natural social skill for many children, some with autism may avoid looking directly at others, especially during social interactions. This lack of visual connection can be noticed as early as the first months of life when the child starts to explore the world around them. Children who avoid eye contact often show difficulty interacting with others and may appear detached from their environment, which can make it harder to understand their emotional and social needs. Eye contact is one of the most important forms of nonverbal communication and is essential in forming emotional bonds, especially between parents and children. When a child avoids looking into someone's eyes, this may be an early sign that they have difficulty perceiving or processing social interactions. It's important to note that autism is a spectrum, meaning the signs can vary greatly from one child to another. Some may have significant difficulties with eye contact, while others may simply have a different style of interaction that still falls within typical ranges. Another early sign of autism that parents and caregivers might notice is difficulty responding to their name. Young children usually start responding when called, whether with a glance, a smile, or a verbal reaction. However, children on the autism spectrum may not respond or may take longer to react when called by their name. This delay or lack of response can be one of the first signs that the child has difficulty perceiving and interacting with their environment. While it is normal for infants to not immediately respond to their name, this usually develops as the child grows. If you notice that a child consistently does not respond when called, this could be an indication that they are having difficulty recognizing and processing social interactions, something that is very common in autism. However, it's important to remember that this doesn't necessarily mean the child has autism. In many cases, the lack of response to their name could be due to other developmental issues or even hearing problems. The key here is to observe patterns and consult a professional if the behavior persists. Another early sign of autism that parents and caregivers might notice is difficulty responding to their name. Young children usually start responding when called, whether with a glance, a smile, or a verbal reaction. However, children on the autism spectrum may not respond, or may take longer to react when called by their name. This delay or lack of response can be one of the first signs that the child has difficulty perceiving and interacting with their environment. While it is normal for infants to not immediately respond to their name, this usually develops as the child grows. If you notice that a child consistently does not respond when called, this could be an indication that they are having difficulty recognizing and processing social interactions, something that is very common in autism. However, it's important to remember that this doesn't necessarily mean the child has autism. In many cases, the lack of response to their name could be due to other developmental issues or even hearing problems. The key here is to observe patterns and consult a professional if the behavior persists. Children with autism often exhibit repetitive or stereotypical behaviors, which can include actions like rocking the body, clapping hands, spinning objects, or repeating certain movements consistently. These behaviors may be a way for the child to self-soothe or deal with stress or anxiety. These repetitive behavior patterns can begin to appear as early as the first few years of life, and they are often more intense or noticeable during moments of excitement or frustration. It's important to note that these behaviors are not necessarily a sign of disobedience, but rather the child's attempt to find comfort or security in what is familiar and predictable. While repetitive behaviors can be common in young children as they explore the world around them, when these behaviors become excessive or interfere with daily activities, they may be a sign that the child is on the autism spectrum. These behaviors often persist over time, but their intensity can vary. In some cases, they may even decrease, with appropriate interventions such as behavioral therapy. Delays in language development are one of the most common signs of autism. Children with autism often face difficulties in acquiring language, which can manifest in various ways, such as trouble forming sentences, understanding words, or even a lack of interest in using speech to communicate. Some children may start speaking later than typical children, while others may never develop verbal speech in a conventional way. Additionally, they may not use language interactively. For example, instead of using words to express their needs or feelings, the child may resort to gestures or other forms of nonverbal communication. It's important to note that a delay in language development does not necessarily mean that a child has autism. There are several reasons why a child may have a speech delay, such as hearing issues or motor development problems. However, if the delay is accompanied by other signs of autism, such as difficulty with social interaction or repetitive behaviors, this could be an indication that the child needs a more thorough evaluation. Another common trait in children with autism is difficulty playing with other children in a cooperative manner. While many typical children engage in pretend play, interact in games with rules, and share toys easily, children on the autism spectrum often prefer to play alone or struggle to join group activities. A lack of interest in pretend play can be one of the first signs. Games like make-believe or pretending are essential for social and cognitive development, as they help the child understand the world and practice social skills. Children with autism, on the other hand, may show a preference for solitary activities, such as lining up objects or playing with a specific part of a toy, rather than using it in a more imaginative way. Additionally, interaction with other children can be challenging for many children with autism. They may not understand unspoken social rules, such as waiting their turn or interpreting the emotions of other children. This can lead to difficulties in forming friendships and in social interactions in general. Children with autism often show atypical sensory responses, which can manifest in two ways, either an increased or a decreased sensitivity to sensory stimuli. Some may become overwhelmed by certain sounds, lights, textures, or smells, while others may not react to these stimuli at all. For example, a child with increased sensitivity may startle easily at loud sounds, like a vacuum cleaner or a siren, or feel discomfort from certain fabrics like clothing tags or rough-textured clothes. On the other hand, some children with autism may not perceive these sensory stimuli as intensely, and may not react to pain or other stimuli that would typically bother other children. These differences in sensory perception can lead to discomfort, or difficulties in adjusting to different environments. For instance, the child may avoid certain places due to fluorescent lights, or may become extremely agitated in noisy environments like supermarkets or parties. Identifying these reactions and finding ways to accommodate the child's sensory needs can be an important way to provide support. Children with autism often show a strong resistance to changes in their routine or environment. They tend to feel more comfortable when things follow a predictable pattern and can become quite anxious or upset when something out of the ordinary happens. This can include simple changes, such as a new route to school, a change in mealtimes, or the introduction of new toys or activities. This rigidity can manifest in various everyday situations, such as resistance to new foods, insistence on playing with the same toy every day, or even aversion to changes in bedtime. This need for predictability is a common trait of autism and can be reflected in frustration behaviors or even crying episodes when the routine is altered. It's important to understand that this resistance to change is not an act of disobedience, but rather a way for the child to cope with anxiety and insecurity. Offering predictability and creating a structured environment can help minimize the stress caused by these changes. Many children with autism struggle to perceive and understand the emotions of others. This can manifest in various ways, such as difficulty interpreting facial expressions, understanding tone of voice, or recognizing signs of emotions like anger, sadness, or happiness. For example, a child with autism may not respond to a sad expression on an adult's face or may not know how to comfort someone who is crying. They may also have difficulty identifying their own emotions, which can lead to challenging behaviors when they feel frustrated or overwhelmed, but don't know how to express it appropriately. Additionally, children with autism may have difficulty understanding that other people have different feelings and perspectives from their own. This can affect their ability to make friends or interact empathetically with others. Observing these signs and encouraging emotional communication can be an important part of supporting the child in developing social and emotional skills. A common characteristic in children with autism is a deep and sometimes obsessive interest in specific topics. They may focus intensely on one subject or activity, often ignoring other interests or activities around them. These interests can be quite narrow, such as a fascination with certain types of toys, animals, numbers, or even more unusual topics like maps or complex systems. While any interest in something can be normal in children, in the case of children with autism, this excessive focus can be so intense that they become inflexible about their interest, refusing to switch activities or even becoming frustrated when their topic of interest is not available. These children may talk about the subject incessantly and show great pleasure in learning more about it, but may have difficulty expanding their interests to other areas. The intense focus on a single topic may be a way for the child to self-soothe or find comfort in something they understand well. While this can be a valuable skill in certain situations, like developing specialized knowledge, it may be necessary to guide the child to explore new interests and activities to promote more balanced development. Difficulty making and maintaining friendships is one of the most noticeable signs of autism, especially as children grow older. Many children with autism struggle to understand social norms and interact with other children appropriately. This can manifest as a tendency to avoid group play, not knowing how to initiate or maintain a conversation, or even not understanding the need to share or take turns. A lack of interest in making friends or interacting with other children may be noticed early on, but becomes more apparent as the child enters older ages, when social interactions become more complex. In some cases, children with autism may prefer to play alone or with a trusted adult, rather than engaging in activities with other children their age. While social interaction is difficult for many children with autism, it is possible to teach social skills and help the child develop friendships with the right support. Early interventions such as social skills therapies can make a big difference in improving the social abilities of a child on the autism spectrum. Identifying the early signs of autism can be challenging, but the earlier it happens, the greater the chance to offer the necessary help and support for the child to develop in the best possible way. As we saw, there are a variety of signs that may indicate a child is on the autism spectrum, ranging from difficulties in social interactions to repetitive behaviors and intense interests. Each child is unique, and the signs can vary from mild to severe, but being aware of these indicators can help seek professional evaluation, which is the first step toward an accurate diagnosis. If you notice any of these signs in a child, it's important to seek guidance from a qualified professional. Early intervention is crucial to help the child reach their full potential and develop skills that will be valuable throughout their life. Do not ignore these signs. They may be the key to a more balanced life filled with opportunities. Remember, this is an educational video and should never replace a visit to a doctor or healthcare professional. If you have concerns about a child's development, always seek medical advice. If you found this video helpful, don't forget to like, subscribe to the channel, and leave a comment below. We'd love to hear your thoughts. If you've encountered someone with these signs or have any experience to share, let us know in the comments. Your experience might help others going through similar situations.